Hi, I'm Amber. I'm a registered dietitian nutritionist, and this is part one of a nutrition assessment lecture series. And in this first video, students are going to be introduced to the nutrition assessment. So the objectives of this first video: by the end of this video, students should be able to define nutrition assessment, describe the purpose of the nutrition assessment, identify the key components of nutrition assessment, explain the link between nutrition assessment and health outcomes, and understand the professional role of the dietitian nutritionist in the nutrition assessment. Now, what is the nutrition assessment? It is a systematic approach to collect, classify, and synthesize important and relevant data or indicators that are needed to identify nutrition related problems and their causes. So, simply put, it's the way that we gather information on a patient, and then we want to classify that information, interpret it, so that we can understand what are the nutrition related issues or problems that this patient is experiencing and what are some of the potential causes of these nutrition related problems. The nutrition assessment is the first step of the nutrition care process. And the nutrition care process, the first step, as I mentioned, is the assessment where we are collecting nutrition related data. We then move into step two, being the diagnostic step, where we are defining existing nutrition problems. We then move on to the intervention step, where we are purposely planning action that is designed to um, initiate some behavior change in the patient. And then lastly, we have monitor and evaluation, where we are identifying outcome indicators and how we're going to track progress in that patient. So the nutrition assessment that we're covering in today's video is the first step of this entire nutrition care process. Now, you may be asking, well, what is the purpose of the nutrition assessment? It helps us to collect nutritionally relevant data, and then it allows us to then identify nutrition related problems, which we will define as the PES statement or the nutrition diagnosis. So we identify nutrition related problems, and then this nutrition related problem or these that we've identified are going to inform and guide the intervention and the plan that we design for our patient. It also allows us to connect the science to the practice because as a dietitian nutritionist, you are expected to, it's the ethical way to provide evidence-based recommendations for your patient. So the nutritional assessment really is setting a tone for the nutritional treatment and management of the patient. Here, I'm going to introduce you to the ABCD framework of nutrition assessment, although this is going to be covered in more detail in a subsequent video. Now, the ABCD framework of nutrition assessment refers to the type of data that is collected from the patient. So when you think about, I want to conduct a nutrition assessment, what do I need to collect? A, anthropometrics. So we're talking about height, weight circumference, and so on. B, biochemical data. So we're looking at lab data, or lab work, blood work, right? Blood sugar levels, hemoglobin levels, cholesterol, and so on. C, being the clinical data, which entails a nutrition-focused physical exam, as well as obtaining information about the patient's medical history. And four, D, dietary. This is where we conduct our 24-hour diet recalls, food frequency questionnaires, food logs, and so on. So the ABCD framework will be covered in more detail in a subsequent video, but this is just to introduce you to the type of data that you're going to be collecting as part of your nutrition assessment. So this is an assessment snapshot, right? And as I mentioned, there are various types of data that you want to collect. We're looking at documenting first name, last name, date of birth, because sometimes you may have patients with the same name and you want to be able to distinguish them by their date of birth, getting some demographic information, and then moving into a client history, understanding have they ever seen a dietitian before? That's important because sometimes you want to know what do they know? What about nutrition and nutritional management of their health condition? Are they aware of anything already? And how do you fit into that? Getting a concept of their appetite, any foods that they're allergic to, lactose intolerance. Are they having any challenges with chewing and swallowing, vomiting, nausea, constipation, diarrhea? What are their usual bowel habits? As a dietitian nutritionist, get comfortable having conversations about bowel habits, okay? And supplements, medication lists, and so on. So this is just a snapshot of what a nutrition assessment form or part of what a nutrition assessment form looks like or can look like. Now we want to have an understanding of what is the link between the assessment and health outcomes. So the nutritional assessment data is then going to be compared. So the information that you collected from that patient needs to be compared to some reference standards or comparative standards for you to understand, is this normal, is this low, or is this high? Okay. And this can then help us to diagnose malnutrition. It can help us to identify nutrient or potential nutrient deficiencies, and it can help us to understand that patient's risk of disease. The link between the assessment as well is that it can help with the early detection of nutrition problems, and it can even help with the prevention of disease progression because we're picking up on things and we're able to now design an intervention that can appropriately treat or appropriately support the patient. And then what we found is that once we have these early detection of nutrition problems and the ability to design personalized interventions, we can then expect to see some improved patient outcomes, population health, and overall quality of life. So, as a dietitian nutritionist, the nutrition assessment is essential. Whether you are in a hospital setting, public health, private practice, or community setting, we rely on a well done nutrition assessment for us to understand how am I going to treat with this patient or with this community at large? How are we going to move forward? So, as a dietitian nutritionist, it's important for you to understand the responsibilities and ethical considerations when collecting and interpreting data. So, you want to have a respect for confidentiality, right? You want to understand how we're going about collecting this data. We also want to recognize the importance of cultural competence and sensitivity during the assessment process. And we will continue to dive into these as we go through the remaining videos in this nutrition assessment series. So, up next, we have the ABCD framework of nutrition assessment, where we are going to be taking a deep dive into the type of data collected and how they influence the nutrition care process.